Good morning, Sri Lanka. Welcome to the show. You're here with me, Amaya, on a brand new Thursday morning. So, which means we're nearing the end of the week. The last time I saw you was on Monday, so that was not a great day for anyone. But I'm sure that right now, closer to the end of the week, you're all feeling a bit happier and you're excited about the day that's coming up. But 7:15 in the morning is always a great time to think about what you're going to do for the rest of the day and make your plans, get everyone out of the house if they have places to be and things to do. And at the same time, there may be some of you who are going out to speak to other people, speak in a public forum. Or when you go about your daily tasks, there are so many things that we come across that puts a little fear in us. We get a bit nervous about making the big presentation to our clients or speaking to someone about a medical condition that they might have, anything like that. But there is a difference between a rational fear and an irrational fear. And that difference is what we are going to speak to you today about on Good Morning Sri Lanka. Because on today's show, we are going to be focusing on a medical condition known as phobia. Now, to speak about that, I'm not going to tell you all about this. We have an expert panel here who will help us out with that. So we have with us Dr. Mahesh Rajasurya, Professor Hemamali Pereira, and Dr. Ramesh Jayawardena. So good morning. Jaisekara, I'm sorry. Jaisingha.
Yeah.
So welcome to the show, and it's great to have you. Good morning.
Good morning. Thank you.
Good morning.
And speaking about fears, I'm sure that now Dr. Ramesh and Professor Hemamali have been here on the show with us, so I think they are very comfortable in front of a camera. But you've also been on Sirius and other channels, and you've done shows with them, so I'm sure there's no fear of the camera to overcome today. But tell us, what is a phobia, and how would you define something as a phobia as opposed to just a fear of something?
Yes, I think you introduced that at the beginning itself, that lots of people have fears. They're scared of situations, certain things. But phobia is a medical condition where the fear goes beyond the normal boundaries that you can talk about. So it's the fear itself is very intense and it's very distressing. And the intention, the main intention of that person is how to avoid it. Now, so that's what defines phobia in mental health terms, in medical terms. The fear is very intense. It's very uncomfortable because the anxiety is very high, and the main intention of that person is how to avoid that. So whether it's a height, they will avoid it. If it is a social situation, the main intention is how to avoid that situation, because they anticipate it to be a very, very difficult situation with intense fear that is beyond their control. They don't know how to control, because a lot of our fears we can actually control. But when it comes to phobia, it's beyond your control. So that's why it had crossed the normal boundaries, and now it is an illness.
I see. So this is something that other people would actually perceive as something you shouldn't be afraid of. Is there something like that, where it's a perceived fear, where there is no actual danger?
Yes. The two words that we just listened to, fear and anxiety, as described by Professor Hemamali Pereira, have two different meanings. Fear is also used to denote, for an example, if you are walking on a deserted street and somebody is running behind you with a knife in his hand, you have fear. Right? And you do, of course, have anxiety as well. In phobias, it's not just a fear of an actual fear that we are talking about. In a phobia, the fear is coming in the form of anxiety. Now, anxiety is frequently used, together with the word fear in a synonymous way. But anxiety really means is, let's say you're facing an interview, right? And a job interview, and it's very important, and you don't know whether you would get selected or not. If you get selected, it will be one of a life chance kind of thing. and then you are called into the room for the interview. Your heart starts racing, and you feel the sweat coming on your face, and you can't remember the answers that you had rehearsed all these last few days. So that is the feeling that we call anxiety. So this anxiety can be very severe in a phobic condition, which is the disabling condition which Professor described to you, which limits your functioning, which makes it so bad. The feeling is so bad when it's very intense. You want to avoid it at by any way. So you avoid the stimulus which gave you the anxiety.
I see. And there is a effect that this has on your daily life, I'm sure, because if you have an irrational fear of heights, if you have a phobia for heights, how can these phobias affect someone in their daily activities, doctor?
Yes, now as the doctors were explaining, now this phobia is an irrational fear. Very often it's called an unreasonable fear because it's very extensive, excessive, the fear factor. It results in an anxiety reaction, and this anxiety that comes from the phobia has both physiological and psychological or emotional symptoms or manifestations.
Yes.
So it can actually be so debilitating to the extent that the person is not in control of himself. He feels that he's totally out of control, and it can lead to a panic attack.
I see.
A panic attack, and a panic attack is a very intense form of anxiety reaction where a person may have thoughts of going crazy, that he's going to die, or that he's going to have a heart attack, you see, or that he's going to faint or have a blackout kind of thing, or he will just pass off. So this can be very intense, and if this happens on a daily basis, in the workplace or in the home or in the school environment, it can be really disturbing to the day-to-day activities of a person.
Yeah, so this is something that you really need to watch out for, and phobia should be dealt with as soon as possible, I'm sure. But we have a small video already about how you can overcome different types of fear. But before that, let's go into the most common types of phobias that you've come across in your daily practice. Dr. Mahesh?
Yes, now phobias can be broadly divided into two types. One is, within phobias, you have, when you have a phobia for a certain condition or a situation, you have thoughts related to that situation. Let's say, for an example, somebody who's scared of public speaking. So you have thoughts that, if I start speaking in public, I might not find the right word, and then people might laugh at me, and all those kinds of thoughts. And then you have emotions. You have fear, anxiety, you want to avoid, and all that. And then you may have behaviors where you don't go there, you avoid public places, you avoid any chances of being invited to speak in public and all that. So in different kinds of phobias, these different components may be working in a different combination. Now, for an example, there are kinds of phobias which are called specific phobias or simple phobias. For an example, it's a very simple, very easy to name kind of a situation. Say, for an example, somebody is scared of cockroaches, right? Or phobic of cockroaches. Or another person may be phobic of flying.
Of course.
Or driving, or dental procedures. You just can't go and sit in a dentist chair. It's very difficult. So in these conditions, it's more or less, it's simple to explain. It's, you just can't go and sit in a dentist chair. You have this anxiety coming up when you see the dentist's office and then the chair, and when you go and sit there. So you try to avoid that. You try to delay your appointment to get your scaling done or whatever. But then there is another set of phobias, mainly social phobia, fear of public speaking and meeting new people. And then there's another condition called agoraphobia, where you are scared to leave safety. So you
I see.
you feel safe in your home. You don't want to leave home, so you get out
I see.
to the outside and you feel very scared. Or you go into a crowded place where nobody knows you and nobody is looking at you, and you feel very scared, and if something happens to me, who's going to help me, kind of thing. But if you have somebody with you, you don't feel scared. In these, and the other thing is the public speaking, the social phobia, where it is kind of the opposite of agoraphobia. If you are in a crowd, if nobody is paying attention to you, you are safe. If people start paying attention to you, you feel scared.
I see.
They might start criticizing me, I might look odd, my posture may not be perfect, and they might laugh at me, my choice of words may not be appropriate, and that kind of thing. But these two conditions, agoraphobia and social phobia, are phobias, which are different from specific phobias because they are more complex than specific phobias.
I see.
There are lots of thoughts associated with these two conditions. In contrast to specific phobias, where it's a very, very simple kind of just a fear of one particular condition.
And I guess these are triggers. Would you say that specific phobias have a very specific trigger, as opposed to the social phobias that you mentioned, where you have so many different things that can cause this fear?
Exactly. Some people who have social phobia may find it difficult to answer the telephone.
Oh, I see.
Because it's a social interaction. The moment you pick up the phone, you have to initiate a social interaction, and you don't know who that is.